In 2013, a new type of drug, sodium glucose cotransporter 2 inhibitors, also known as SGLT2 or canagliflozin, was released into the market to treat type 2 diabetes in adults. In the first quarter of 2015, Janssen's profits from Invokana were over $270 million in sales. Over 450,000 prescriptions of Invokana are filled every 3 months in the United States. Both Invokana and Invokamet are made by Janssen Pharmaceuticals, a Johnson & Johnson company. In healthy people, the liver produces glucose during fasting to maintain normal levels of cell energy production. After people eat, the pancreas releases insulin. Insulin is the hormone responsible for glucose absorption. Once insulin is released, the liver should turn down or turn off its glucose production. But in people with type 2 diabetes, the liver fails to sense insulin and continues to make glucose. Invokana and Invokamet are given in the form of a pill and work by preventing glucose absorption into the blood. As a result, more glucose is excreted in the urine, lowering blood glucose levels in adults with type 2 diabetes. In May 2015, the FDA issued a safety warning for all SGLT2 inhibitors, including Invokana and Invokamet, after receiving reports of patients who developed diabetic ketoacidosis. On December 4, 2015, the FDA revised the label on Invokana to include ketoacidosis after a growing number of patients were hospitalized. As of May 2017, the FDA has updated a warning after trial results found an increased risk of leg and foot amputations in patients taking the diabetic medication Invokana or Invokamet. Amputations of the toe and middle foot were more common. However, amputations involving the leg, below and above the knee also occurred. Some patients had more than one amputation, some involving both limbs. As scary as this sounds, do not stop taking your diabetic medications without first talking to your healthcare professional. Doing so may lead to uncontrolled blood sugar levels that can be harmful. Traditional type 2 diabetes medications work to stop the glucose produced by the liver. Invokana doesn't stop the production, just the reabsorption of glucose into the bloodstream. While this may sound like a good idea, the problem is Invokana and Invokamet are associated with amputations above and below the knee, kidney failure, diabetic ketoacidosis, and myocardial infarction, commonly known as a heart attack, which includes the irreversible death of cells within the heart. After experiencing life-threatening side effects, many patients have sought compensation from the drug manufacturer Janssen Pharmaceuticals. If you or a loved one took Invokana or Invokamet, you may have experienced any of the following life-threatening complications: diabetic ketoacidosis, kidney failure, dialysis, coma, hospitalization, amputation, or even death. The FDA said patients should stop taking their SGLT2 inhibitors and seek medical attention immediately if they have any symptoms of ketoacidosis. Symptoms include nausea, vomiting, abdominal pain, tiredness, and trouble breathing. Contact Periscope Group today so we can get you the help you need to seek financial compensation. Periscope Group, making sure consumers don't become collateral damage.